Good afternoon, Dr. Eric Lajinsky here. We're going to talk about today low back pain and movement quality. When a patient presents with lower back pain, they usually move very slowly. They can't sit up straight. Sometimes I see them sitting up straight by putting their hands on their thighs, pushing themselves up. They make facial expressions that they're grimacing or they're uncomfortable when they roll over on our table or when they get out of the chair. And these are all signs of not only obviously a problem in the spine, but also instability in the lumbar spine. Movement coordination is not in sync. There's some impairment there. And over time, a patient will actually adapt these poor movements by compensating. And what happens is muscles that are not being used get weakened, and muscles that are not accustomed to handling a lot of loading get overused. And it creates inflammation, it creates irritation. So once a patient's out of the acute phase of care in our office through the adjustments, through the stretching, ice, whatever they're doing in the office, once they start to feel better, it's important that we address some of the weaknesses in the muscles. And I'm going to talk about the big three areas or movements that I feel that are beneficial to maintain lumbar stability and enhance movement quality. The first thing is abdominal bracing. Abdominal bracing can be done anywhere. You can be seated, you can be in the car, you can be standing, you can be laying down. And it's basically just drawing your abdomen, your abs in, sucking them in, tightening them up, okay? Even tighten up your glutes as well. We have a lot of our patients do this when they're doing pelvic tilts, when they're laying down and they're pushing their abdomen or their lower back into the floor or into the table to brace their abdominal area. Holding the air in, bracing that area, strengthening and tensing those muscles up. This is what we refer to as abdominal bracing. And it only has to be done for 5 to 10 seconds, and then you release, and done over and over again. It actually creates core strength in your abdomen. So that's number one. Number two would be a lateral trunk strengthening exercise like side-lying planks or side-lying pelvic tilts or pelvic lifts, where you're lifting your pelvis off the floor while laying on the side, or you're laying on your side on your elbow or on your arm outreached, and you're strengthening your lateral muscles, your lateral abdominal muscles. Now with all these exercises, you're also tightening up your glutes, your abdomen in the front as well as the side. It's all bracing, it's just hitting it at a different angle. The last one is lower back and glute strengthening. And there's a lot of different ways you can do this. The most familiar ways are that pelvic tilt and bridge exercise. Bird dogs are really good when you're on all fours and you're raising one arm in the opposite leg and you're doing it in sync, creating that movement quality pattern. Again, throughout this exercise, you're strengthening and you're tightening up your abs, your glutes, keeping that core really strong. It's important that you address these, in my opinion, on a daily basis, along with stretching, good postural habits. Nutritional factors are also a thing as well, drinking plenty of water, getting sleep. All these things weigh into making sure that your lower back stays healthy and you avoid any type of injury. So there's just three different types of exercises that will address that core weakness, that instability in the muscles. If you have any questions about this, feel free to shoot me a message. If these aren't working, you're still in pain, please just give me a call. Come on in, we can help you out, get you out of pain as quickly as possible, get things fixed up for you. That's all we got for today, guys. Hopefully you enjoyed the video, and we will talk to you next time. Later.